Hello, everyone, and welcome back to Cancer's 101. I'm your host, Rittika, and today we are turning our focus to a deeply important and often emotionally heavy subject: how infections uniquely impact children with cancer. When a child faces cancer, the battle isn't just against malignant cells. Their still developing immune system is forced into a high stake fight, one it's often unprepared for. Joining me, as always, is our oncology enthusiast, Aditi. Aditi, treating cancer in kids bring a very different set of challenges, doesn't it?
Absolutely. A child's immune system is like a fortress still under construction. There are gaps in the walls, missing guards, and undertrained soldiers. When cancer strikes and we add chemotherapy or radiation to the mix, it's like tearing down scaffolding while the threat is already inside. Take acute lymphoblastic leukemia, ALL, the most common childhood cancer. The disease itself suppresses bone marrow function, but the intensive chemotherapy regimens further drop white cell count, especially neutrophils, which are frontline defenders against the infection.
So infections don't just sneak in, they march through the front gate because there's often no one there to stop them in the first place. And unlike adults, kids can't always describe early symptoms, which delays the diagnosis and treatment. So, what kind of infections are we usually dealing with in pediatric cancer cases?
It's a wide range. Some of the most serious are Varicella zoster virus, VZV, which can spread rapidly and cause severe complications in immunocompromised children. Invasive fungal infections like Aspergillus or Candida, which often affect the lungs or bloodstream. Gram-negative bacteria, such as Pseudomonas aeruginosa, especially in children with central lines. And more recently, respiratory viruses like RSV and influenza, which can escalate dangerously. And because of their age, children are also more prone to gastrointestinal infections that adults might easily tolerate.
It's like the immune systems are constantly being tested in an advanced exam without ever having been given the study materials. Let me share a real case that highlights this. An 8-year-old girl undergoing chemotherapy for ALL developed a persistent low grade fever. Initial tests were inconclusive. Within 48 hours, her conditions deteriorated. She had developed pulmonary aspergillosis. Despite aggressive antifungal treatment, her recovery was slow. Her chemo had to be halted temporarily.
And that pause is significant. Infections don't just make children sicker, they disrupt cancer treatment timelines, which can affect long-term outcomes. In pediatrics, timing is everything, and infections steal precious time.
So, how do pediatric oncology teams try to outsmart these infections?
It takes precise planning and preventive care. Pediatric-specific protocols often include prophylactic antibiotics or antifungals, especially during neutropenia. Strict infection control in hospitals, like limiting visitors and maintaining sterile environments. Routine vaccination. Many kids are revaccinated after treatment to restore immunity. Use of growth factors like GCSF to boost white blood cell recovery. And importantly, psychosocial support because kids and their parents need more than just medicine. They need reassurance, play, and routine, even during treatment.
it, it's like building a protective bubble around the child, specifically, scientifically, emotionally, and socially, so that while their body is healing, their world still feels safe. So, what's the big takeaway today? As I must say, that kids with cancer face triple threat: immature immunity, immune suppression from treatment, the high risk pathogens. Infections are not just side effects, they're major obstacles in recovery. But with vigilant care, tailored pediatric protocols, and early detection, we can outmaneuver many of these infections.
Children are incredibly resilient, but they can't do it alone. It takes a village of doctors, nurses, caregivers, and researchers to keep them safe. And every infection prevented is a battle won in the larger war against cancer.
Thanks for tuning in into Cancer 101. If this episode moved you or taught you something new, please share it with someone who might benefit. Until next time, stay informed and stay compassionate.
And remember, no matter how small the patient, every fight against cancer is a mighty one.